Thank you, Mr. President, and good afternoon. Today, the White House Coronavirus Task Force met, and while our hearts are with the families of those who have lost their life to the coronavirus and those who are struggling with serious illness today, our team, led by Dr. Deborah Birx, informs us that the data continues to show promising signs of progress. The New York metro area, New Jersey, Connecticut, Detroit, and New Orleans all appear to be past their peak, and we are seeing consistent declines in hospitalization and cases in regions across the country. Our only conclusion is that we're getting there, America, because the American people have put into practice the President's guidelines of social distancing, because you've been listening and adhering to the guidance of state and local officials. We're making meaningful progress, in a very real sense, sparing Americans to be exposed to the coronavirus and, in no less extent, saving lives. Our task force actually believes, Mr. President, that if we continue these mitigation efforts in the days ahead, as states implement their policies, including phased reopening that will preserve those gains, we do believe by early summer we could be in a much better place as a nation with much of this coronavirus epidemic behind us. Earlier today, we also had a conference call led by Secretary Ben Carson and leaders from HUD about the President's announcement yesterday that he is repurposing the White House Opportunity and Revitalization Council to focus on the impact of the coronavirus on minority communities. Secretary Carson will convene the council tomorrow and will be reporting tomorrow afternoon on their progress. We want to thank the more than 270 leaders of organizations dedicated to housing, homelessness, and improving the lives of people across our urban communities, not only for being with us today, for the way they have partnered with our administration and partnered with state and local officials to put the health of all of their constituencies first. As the President mentioned, you'll receive a report that our task force received formally this week from Bill Bryant of the Science and Technology Directorate at the Department of Homeland Security. He will outline, as the President said, encouraging news about the impact that heat and sunlight have on the coronavirus, which will increase the confidence that we feel about the coming summer. On the subject of testing, at the present moment, we have reports of 4.93 million tests having been performed across America, and encouraging news as states have been engaging commercial labs at a higher level across the country. Yesterday, our commercial lab system did more than 100,000 tests in a single day, so we're beginning to activate all of the capacity. And tomorrow, at the President's direction, our task force will convene a conference call with all of the nation's governors to talk about their progress that they are making on testing, and we're going to hear from governors about the practices that and methods that they are employing to significantly increase testing following our briefing about capacity in laboratories this past Monday. For instance, Governor Mike DeWine just announced that Ohio's testing has been greatly expanded after the FDA approved Thermo Fisher's new extraction reagent, saying in his words that the action, quote, probably doubled, maybe even tripled testing in Ohio virtually overnight. Governor Tim Walz of Minnesota announced, along with the state's healthcare system, the Mayo Clinic, and the University of Minnesota, what he described as a breakthrough for rapid, widespread testing, able to test more than 20,000 people using a molecular test per day. Governor Kim Reynolds of Iowa launched the Test Iowa initiative that will triple testing capacity by partnering with Nomi Health and Domo. She also worked with the University of Iowa hospitals to leverage further capacity. And Governor Eric Holcomb and Governor Andy Beshear of Indiana and Kentucky, respectively, both announced additional drive-through testing locations. Our priority has always been to focus first on those impacted by the coronavirus and then on those extraordinary healthcare workers ministering to their needs every day. And I know, Mr. President, how proud you are that our men and women in uniform have come alongside our healthcare workers in communities most impacted. And I know the American people are proud as well. As of today, FEMA reports that 35,000 National Guard have been deployed across the country to aid in our coronavirus response. Governor Kevin Stitt of Ohio actually deployed the National Guard to hospitals across the state to evaluate protective equipment and hospital capacity and report it into state emergency management and FEMA. And Governor Greg Abbott of Texas actually mobilized more than 1,200 National Guard and 45 teams to provide greater access to testing. Along with the National Guard, at the President's direction today, more than 4,500 active duty military doctors, nurses, and medical assistants have been deployed across the country. Yesterday, 1,013 medical professionals in our military were actually deployed to 19 hospitals in 7 states to support those amazing healthcare workers. And with 4.4 million more Americans filing for unemployment in the past week, I join the President in welcoming passage in the House today of the Paycheck Protection Program. It'll support working families, allow small businesses to keep people on the payroll for a period of 2 months. But it also, as the President requested, included $75 billion to assist hospitals across the country. And in that spirit, the President and I will continue to urge states across the country, given the unique burden on hospitals, we are now encouraging states to restart elective surgeries wherever possible, either statewide or on a county-by-county basis. We recognize the role elective surgeries play in finances for local hospitals, and we'll be working with states to enable that. In that vein, Governor Doug Ducey issued an executive order not long ago allowing elective surgeries beginning May 1 for hospitals that meet certain preparedness criteria. And Indiana's Governor Eric Holcomb is allowing elective clinical procedures to begin on April 21st. Finally, Mr. President, the task force received today our first report on state reopening plans. At the present moment, 16 states have released formal reopening plans. 13 of those were actually released since you unveiled the Opening Up America guidelines to our governors and to the nation last week. And to your point, Mr. President, states are beginning to make those plans. And we're encouraged to see so many states embracing the phased approach to reopening their economies that's contemplated in our guidelines for opening up America again. For instance, Governor Mike Parson of Missouri announced the Show Me Strong Recovery Plan has 2 initial phases intended to protect the most at risk. Governor Tom Wolf announced the plan for Pennsylvania that would begin May 8th, will end a stay-at-home order for just portions of Pennsylvania, but the plan, again, requires regions to have fewer than 50 new positive cases per 100,000 for a period of 14 days, and it also lays out a phased reopening roadmap. Governor Kate Brown of Oregon updated their framework for reopening, doing 3 phases, again, on a county-by-county basis, and Governor Brad Little of Idaho released Rebound Idaho in just the last few days that will consist of 4 phases and require specific criteria that Idaho and businesses need to meet to begin to reopen. Mr. President, with the guidelines to open up America again, states are making plans, and at your direction, our task force will continue to work very closely, providing them with the data, providing them with the resources to be able to implement those plans in a safe and responsible way. So with that, let me just end where I began and to say thank you to the American people. The progress that we are seeing is a testament to what all of you have done, to our extraordinary healthcare workers, a partnership between the federal government and to state and local officials. And I'm confident it's also owing to the prayers of millions of Americans each and every day. All of that combined, we're slowing the spread. We're protecting the most vulnerable. We're saving lives. And every single day, we are one day closer to opening up America again. Bill Bryant leads the Science and Technology Directorate at the Department of Homeland Security and now will make a presentation on their recent study.
Thank you, Mr. Vice President. Thank you, Mr. President, for this opportunity to do this today. Good afternoon, everybody. My name is Bill Bryant, and I lead the Science and Technology Directorate at the U.S. Department of Homeland Security. Over the last several months, we've intensified the department's R&D efforts to identify and deliver information that informs our response to COVID-19. S&T is working to identify, develop, deploy the tools and information to support our response to this crisis. As part of our efforts, we're leveraging the unique capabilities of S&T's National Biodefense Analysis and Countermeasures Center to study the biology of the COVID-19 virus. This center is a high biocontainment laboratory located in Frederick, Maryland. It was established in the early 2000s in response to the Amerithrax attacks, and where we study, characterize, analyze, and develop countermeasures for biological threats to the homeland. We work closely with the CDC, FDA, HHS, and also our Department of Defense colleagues and many others. Yesterday, I shared the emerging results of our work that we're doing now with the Coronavirus Task Force. And today, I would like to share certain trends that we believe are important. If I may have the first slide, please. And while that's coming up, our most striking observation to date is the powerful effect that solar light appears to have on killing the virus, both surfaces and in the air. We've seen a similar effect with both temperature and humidity as well, where increasing the temperature and humidity, or both, is generally less favorable to the virus. So let me illustrate with this first slide. If you look to the right, you'll see that term half-life with a bunch of timestamps on there. First, let me tell you what a half-life is. We don't measure the virus as far as how long will it live on a surface. We have to measure the decay of the virus in terms of its half-life, because we don't know certain elements. We don't know how much a person expectorates when he spits, right? When he sneezes, whatever the case may be, we don't know how much virus is in there. So that has a bearing on how long the virus is going to be alive and active. So we measure it in half-life, because half-life doesn't change. So if you look at an 18-hour half-life, what you're basically saying is that every 18 hours, the life of the virus is cut in half. So if you start with 1,000 particles of the virus, in 18 hours you're down to 500, in 18 hours after that you're down to 250, and so on and so forth. That's important as I explain the rest of the chart. If you look at the first three lines, when you see the word surface, we're talking about non-porous surfaces, door handles, stainless steel. And if you look at as the temperature increases and as the humidity increases, with no sun involved, you can see how drastically the half-life goes down on that virus. So the virus is dying at a much more rapid pace just from exposure to higher temperatures and just from exposure to humidity. If you look at the fourth line, you inject the sunlight into that, you inject UV rays into that, the same effects on line 2 at 70 to 75 degrees with 80% humidity on the surface, and look at line 4, but now you inject the sun, the half-life goes from 6 hours to 2 minutes. That's how much of an impact the UV rays has on the virus. The last two lines are aerosols. What does it do in the air? We have a very unique capability. I was discussing this with the president prior to coming out. He wanted me to convey it to the only lab in the country that has this capability. But if you can imagine a Home Depot bucket, a 5-gallon Home Depot bucket, we're able to take a particle, and this was developed and designed by our folks at the NBAC. We're able to take a particle of the virus and suspend it in the air inside of this drum and hit it with various temperatures, various humidity levels, multiple different kinds of environmental conditions to include sunlight, and we're able to measure the decay of that virus while it's suspended in the air. This is how we do our aerosol testing. We worked with Johns Hopkins Applied Physics Lab, and we actually developed a larger drum to do actually more testing, and it's 4 times the size of that. So this is the capability that we bring to this effort. So in summary, within the conditions we've tested to date, the virus in droplets of saliva survives best in indoors and dry conditions. The virus does not survive as well in droplets of saliva, and that's important because a lot of testing being done is not necessarily being done, number 1, with the COVID-19 virus, and number 2, in saliva or respiratory fluids. And thirdly, the virus dies the quickest in the presence of direct sunlight under these conditions. And when you look at that chart, look at the aerosol as you breathe it. You put it in a room, 70 to 75 degrees, 20% humidity, low humidity. The half-life is about an hour. But you get outside and it cuts down to a minute and a half. Very significant difference when it gets hit with UV rays. Mr. President, while there are unknown links in the COVID-19 transmission chain, we believe these trends can support practical decision-making to lower the risks associated with the virus. If I could have my next slide, and while that comes up, you'll see a number of some practical applications. For example, increasing the temperature and humidity of potentially contaminated indoor spaces appears to reduce the stability of the virus. And extra care may be warranted for dry environments that do not have exposure to solar light. We're also testing disinfectants readily available. We've tested bleach. We've tested isopropyl alcohol on the virus, specifically in saliva or in respiratory fluids. And I can tell you that bleach will kill the virus in 5 minutes. Isopropyl alcohol will kill the virus in 30 seconds, and that's with no manipulation, no rubbing, just spraying it on and leaving it go. You rub it and it goes away even faster. We're also looking at other disinfectants, specifically looking at the COVID-19 virus in saliva. This is not the end of our work as we continue to characterize this virus and integrate our findings into practical applications to mitigate exposure and transmission. I would like to thank the President, thank the Vice President for their ongoing support and leadership to the Department and for their work in addressing this pandemic. I would also like to thank the scientists, not only in S&T and the NBAC, but to the larger scientific and R&D community. Thank you very much.
Thank you. When you started your presentation, you described this as an emerging result. Does this mean your study is conclusive? Is there more work to do?
We're continuing that. For example, on the aerosol side, you notice the figures were 20% humidity. We're looking at higher humidity levels. We would expect that we even have a greater impact on the virus. We're looking at other types of disinfectants. And so we're as a scientific community, we're continuing to study the virus to understand its characteristics.
Mr. Bryan, can you explain why some hot spots we've seen in the U.S. are hot and humid, like New Orleans, for example?
Let me explain. If you look at the coronavirus as a chain with many links, what we've done through our study is we've identified some of the weak links in that chain that the transmission of the virus depends upon. We identified that heat and humidity is a weakness in that chain. We've identified that sunlight, solar light, UV rays is a weakness in that chain. That doesn't take away the other activities, the guidance from the White House, the guidance from the CDC and others on the actions and steps that people need to take to protect themselves. This is just another tool in our tool belt, right? Another weapon in the fight that we can add to it. And in the summer, we know that summer-like conditions are going to create an environment where the transmission can be decreased, and that's an opportunity for us to get ahead.
But the President mentioned the idea of cleaners, with bleach and isopropyl alcohol you mentioned. There's no scenario that could be injected into a person, is there? I mean,
No, I'm here to talk about the findings that we had in the study. We don't do that within that lab, our lab. So it would be irresponsible for us to say that we feel that the summer is just going to totally kill the virus and that if it's a free-for-all and that people ignore those guides. That is not the case. We have an opportunity, though, to get ahead with what we know now and factor that into the decision makings for what opens and what doesn't. When it's exposed to UV rays, take a playground equipment, for example. The UV rays hitting a piece of playground equipment will kill the virus when it hits on the playground equipment. But underneath, where the sun does not get, if someone touched that and had it on their hands, it could still be there, right? It has to be in direct light of the UV rays.
Right. How should governors who are opening their states working on that incorporate the findings of this study into those guidelines?
I would leave that up to the governors. This is a decision. This factors into their decision process. As I mentioned, with knowing this knowledge and having this knowledge, as we continue to study and further know what the virus does and how it reacts, it could impact the way a governor will look at what he opens in a state, how he opens it, in what environments these things are opened up. But I leave that up to the governors to make that decision. How they incorporate this.
Obviously, at the moment, the advice is stay at home. By the summer, could we be flipping that and saying you'd be much better off being outside with UV rays, all the humidity that Washington brings in August?
I would not go contrary to the guidance that have been issued right now. I think, though, to tell you that if I'm having an event with my family, I'm doing it in the driveway or in the backyard, not inside the house with my children.
How much more research, how much more time would it take to have conclusive results that could be used here? You said these were emerging results.
We first were able to receive the virus back in February is when we started testing. And it is a science-based approach. Science is a process. The doctor can attest to that. It doesn't necessarily line up with goals and targets and other things. It is what it is. But we are now starting to get results. And we're every week or 2 weeks, we're starting to find out something new and something different. And in talking to the task force and the vice president, he's already asked us to come to him every time we come up with some new discoveries that we could share to the public. Bill?
Yeah, sir, have you compared notes with your counterparts in other foreign governments or in private industry who might have been studying the same thing, and do their findings show the same result that you found here?
We do have a very good partnership with a lot of our allies. We work closely with them on this particular topic. We actually authored a document called the Master Questions List. If you go to DHS&T's website, we've already had about 17,000 hits on this document. It actually outlines what all the countries in the world are doing to fill the certain gaps of knowledge that don't exist within the virus and what we do know. And that is really what targets and drives the science community to say, oh, what don't we know now, so we don't duplicate what other people have done. So we've championed that document. It's well referenced, and I would encourage you to look at that.
What would you and other areas of the government need to do on testing, for example, or other things like that to be prepared if it came back in the fall? How would you take advantage of the summer?
It's actually a very good question. It's something the task force already has begun discussing, that we are, if a combination of factors, let me say again, as states put into practice the guidelines to open up America again, implement safe and responsible plans to open up their economies along the lines that the President unveiled a week ago today. As people continue to properly distancing as is recommended in each phase, that in combination with some of these findings could well give us a summer respite from the coronavirus. And our team is already speaking about working on a continuous basis through this summer. Every single day we're increasing testing. Every single day air bridge flights are coming into the country. I can promise you at the President's direction there will be no letting up on making sure that our hospitals have the equipment, have the personal protective supplies for medical personnel. There'll be no letting up on the development of therapeutics by our great pharmaceutical companies, or driving toward a vaccine as soon as it is possible to make available to the public. And there'll be no letting up on continuing to scale testing, already more than anyone in the world, but by next fall we'll have a broad range of testing, a variety of different means. And that's why we say with confidence that should the coronavirus reemerge at any point next fall or next winter, we will be prepared to deal with it, identify it, do the contact tracing and isolation to ensure that we deal with this epidemic in the manner that we deal with infectious diseases.
Okay.
Do you have any information from other countries that would inform us about the decline?
Yeah, so many of you, and I've spoken to all of you from this podium about there's weekends difference in reporting, often a spike on Monday. If you look at Mondays over Mondays, if you look at 7-day reporting, we are starting to go down. We had a long flat peak, largely driven, of course, by New York, which is about 45% or so of the cases. As New York goes down, so will the rest of the country have a decline, even more accelerated. I want to say, though, we have had outbreaks. We've had outbreaks in specific prisons. We've had outbreaks in specific nursing homes. We've had outbreaks in specific plants. And when that happens, that adds 200, 300, 400 cases on that single date. So we track very carefully not only what the country's doing, but what each state is doing, each county is doing, and we look at delta changes across all of the counties so that we find early warning signals for these types of outbreaks, because we want the whole country to go down, but we also want to prevent the outbreaks before they occur.